The Food and Drug Administration recently proposed to remove a commonly used decongestant from cold medicines due to its ineffectiveness. The decongestant, known as phenylephrine, has been a staple in cold remedies for many years, purportedly offering relief from nasal congestion. However, recent studies have called into question the efficacy of phenylephrine, leading the FDA to consider removing it from over-the-counter products. Phenylephrine was first approved by the FDA in the 1970s as a replacement for pseudoephedrine, which had become a common ingredient in cold medicines but was also being misused in the production of methamphetamine. Phenylephrine was thought to be a safer alternative, as it was less likely to be abused. However, its effectiveness in relieving congestion has been a subject of debate ever since. According to the FDA, recent studies have shown that phenylephrine may not be any more effective than a placebo in relieving nasal congestion. This lack of efficacy has raised concerns about the continued inclusion of phenylephrine in over-the-counter cold remedies. The agency is now considering removing phenylephrine from these products to ensure that consumers are receiving effective treatments for their cold symptoms. So, what are the alternatives to phenylephrine for treating congestion? One option is to use nasal decongestant sprays, which can provide more immediate relief from congestion. However, these sprays should be used sparingly, as overuse can lead to rebound congestion. Another option is to use oral decongestants that contain pseudoephedrine, which is still considered effective in relieving nasal congestion. The potential risks associated with phenylephrine are not limited to its lack of efficacy. Some studies have suggested that phenylephrine may have adverse effects on blood pressure, particularly in individuals with hypertension. This raises concerns about the safety of using phenylephrine in OTC cold remedies, especially for individuals with underlying health conditions. The FDA's decision to consider removing phenylephrine from cold medicines could have a significant impact on both consumers and the pharmaceutical industry. Consumers may need to seek alternative treatments for their congestion symptoms, while pharmaceutical companies may need to reformulate their products to comply with new regulations. Overall, this regulatory change underscores the importance of evidence-based medicine and ensuring that consumers have access to safe and effective treatments for their cold symptoms. In conclusion, the FDA's proposal to remove phenylephrine from cold medicines reflects a growing concern about the efficacy and safety of this common decongestant. While alternative treatments are available, it is crucial for consumers to be informed about the potential risks associated with phenylephrine and to consult with a healthcare provider before using any over-the-counter medications. This regulatory change highlights the importance of ongoing research and scrutiny of pharmaceutical products to ensure that consumer health is protected.